So a lot of these technologies, I think when we first think about them, come into play inside the formal care delivery system, dealing with people who already have a disease. Are there ways that they move outside of the formal care delivery system?
So traditional medicine has sort of somewhat been siloed in the clinic, in the hospital, and after there's been a presentation of a disease or a symptom. What I think that technology trends are enabling now is sort of the democratization and ubiquitous low-cost access to data, whether that's our vital signs that can now be measured on low-cost devices that we wear. Some are going to be attached to our watches. Some will be embedded in our mattresses. So the ability now to get clinically useful data at home, sometimes on a continual basis, will hopefully start to enable us to pick things up far earlier than when they present at stage 3 and stage 4 with the heart attack, with the stroke, with the large tumor.
All this technology sounds like it's going to be kind of expensive. Is this only for people with the means to pay for it?
You know, we think of medicine getting more and more expensive, and in some realms it is. But for example, in the realm of genomics, the sort of brave new world of being able to look at your own DNA, what used to cost several $1 million a few years ago is dropping at twice the rate of Moore's Law, to we're at the point now of essentially a $1,000 genome, and pretty soon a $100 genome, less than the price of an X-ray, for example. And so just like the price of a hard drive or a computer has gotten much cheaper, some technologies are getting cheaper and can be put together in new ways. So particularly when we start to be able to measure things less expensively, like your vital signs and your activity, when you can pick up point-of-care lab diagnostics at home, when you can connect to your social network and track your health metrics, whether that's for prevention or therapy, those can actually be done almost for free now on your mobile platforms, sort of free apps, very low-cost sensors, pretty low-cost diagnostic devices.
For 10 points, answer a question you wish we'd asked but didn't.
The question I would ask is what's exciting in healthcare today? And I think what's exciting in healthcare today is that many of these technologies we've touched upon are coming down in price and dramatically improving in performance to the point where they're now being applied in medicine, from AI to mobile to gaming to big data to robotics to do-it-yourself kits to unmanned aerial vehicles that could deliver drugs. All these things are now becoming accessible, and to the point where a smart high school student can start to leverage them in smart new ways. And what I think is interesting is in the last couple years, we're starting to see this trend of folks from all these different fields coming together to rethink healthcare. And it's been pretty active in IT, healthcare, but it's starting to come into medical devices and quantified self and leveraging apps and big data. And there's sort of a lot of new energy and blood into rethinking healthcare, not the way your grandfather or father or Dr. Welby did it, but how we might do it as sort of the Dr. McCoy, leveraging what used to be very expensive and magical technologies that are now coming to the point where we can hold them in our hands for less than $100.